Hello. So this is on what are the differences and similarities between the common cold, flu, and COVID-19. I've heard a lot of people saying that this is just like the flu, or with everything going on in the world, it's, um, but the things are very, very different with everything going on right now. So here are some of the differences. I just noticed a chart that I have that I wanted to read off was a little small. Hold on, let's see if I can adjust this so I can see it better. Okay, there. There, I see all the categories now. So, I'm going to list a list of symptoms and then talk about them in each aspect. So, first we have fever. In a cold, it's mild if present. With a flu and COVID, it's often. Tiredness. With a cold, occasional, mild. With the flu, it's common. And with COVID, it's occasional. You may not feel tired. Sneezing is common with the cold, infrequent with both flu and COVID. Body aches. That's common with both cold and the flu, but it's only occasional with COVID. Sore throat. It's common with the cold, occasional with flu and COVID. Stuffy or runny nose is common with the cold, occasional with the flu, and infrequent with COVID. Diarrhea, none with cold, occasional with the flu, and infrequent with COVID. Watery eyes, common with the cold, common with the flu, infrequent with COVID. A cough, mild with a cold, a dry cough with the flu, and a dry, often severe cough with COVID. Shortness of breath is none with a cold, it's rare with a flu, and with mild and moderate infection for COVID. Difficulty breathing, there's none with the cold, in severe infections with the flu, and common in severe infections with COVID. So, although this table covers like signs and symptoms of these conditions, it does not clearly prioritize the similarities and differences that medical professionals mainly use to differentiate and diagnose. Consequently, the following will summarize the main features of each disease and actual proposed treatment. So, we have transmission for COVID. Many coronavirus types infect species of animals that occasionally are able to infect humans. MERS coronavirus is an example of where the virus that actually only infected camels became able to infect humans. Wuhan coronavirus is similar as the initial infected people frequented an open-air food service market that sold fish and animals, including wild animals. Medical researchers currently do not know the animal species infected, but wild animals are a suspected source. However, the rapid spread of the virus was due to person-to-person contact that has been responsible for the wide outbreak of this infection, COVID-19. Close contact with someone who is infected, or with their secretions, such as coughs, generated droplets, or sneezing, or feces, is how the virus spreads. Although this virus is contagious, the contagious period of time remains to be determined. Recent findings suggest it may be contagious or even in the incubation period when the patient shows no symptoms. The common cold is a viral infection of the upper respiratory system. So that's your nose, throat, sinuses, can't read that, your throat tubes, your larynx, your bronchial tubes. However, more than 200 different viruses may cause the common cold. Colds are contagious and can be spread from person to person and have an incubation period of about 1 to 7 days. Um, how long it lasts, is usually about 7 to 10 days. However, depending on the viral strand, a cold could last up to 2 weeks. Doctors mainly diagnose a cold by using clinical observation and medical history. There's not really tests that are necessary. So, flu. Influenza, commonly termed the flu, is a viral infection of the upper respiratory and lower respiratory systems. Influenza viruses cause the flu. These viruses usually cause more serious symptoms in the respiratory system than cold-causing viruses. The flu is contagious and can be spread from person to person and has an incubation period of up to 1 to 4 days. The flu's duration varies from about 5 days to 2 weeks, depending upon the severity of the infection. The flu can become an intense and potential fatal illness in some individuals. Hallmarks of the flu include mild or high fever, moderate to severe headache, cough, fatigue, and body aches. Severe flu may have symptoms that develop rapidly and require supportive care. Doctors diagnose the flu based on clinical symptoms and by readily available lab tests. So, COVID-19, also termed the Wuhan coronavirus, is a single-stranded positive sense RNA coronavirus. It is a new strain of coronavirus responsible for causing a pandemic of serious respiratory problems that started in Wuhan, China. Researchers believe it originated from infected animals and jumped over to infected people in a large open seafood or animal market. Also, it has been able to spread from person to person and is rapidly spreading worldwide. It is related to the SARS and MERS coronaviruses, MERS. It has an incubation period ranging from 2 to 14 days. Person-to-person spread may happen even if the infected person has no symptoms during the incubation period. Infected people may not also be aware that they have the virus and may not show any symptoms. The main symptoms of COVID-19 are fever, usually high, moderate to severe coughing, and shortness of breath. Other symptoms and signs may include a sore throat, diarrhea, body aches and pain, and a stuffy and a runny nose. Some people have even reported a lack of taste. At first, it seems to target people over 60 years old and have severe underlying health conditions like heart disease, lung disease, and diabetes. But recent data from Italy suggests that people 20 to 60 years of age may get the disease at the same rate, but 80% recover without specific treatment, while about 20% may require some respiratory support. So, treatments for COVID-19, flu, and the common cold. Colds. Doctors recommend rest, fluids, and over-the-counter medications like ibuprofen, acetaminophen. No vaccine is available for the common cold. Flu. Early treatment with an antiviral drug like Tamiflu, rest, fluids, and acetaminophen, and respiratory support can help. If the flu symptoms become severe, vaccines are available to reduce the symptoms and prevent the flu. COVID-19. Medical professionals recommend rest, fluids, acetaminophen, and respiratory support. If COVID-19 symptoms become severe, antiviral drugs and vaccine research is very active, but none are currently available. Antibiotics are not indicated to for these 3 viral diseases. However, they may be useful in secondary bacterial infections. So, thanks for watching.